Hi everybody, welcome to Clinical Kinesiology. Make sure that you have read through your syllabus. Make sure you know why you are taking this class. Clinical Kinesiology is a prerequisite here at the Northwest Arkansas Community College for the Physical Therapist Assistant Program. Okay, so let's go ahead and get started. Chapter 1, Basic Information. Kinesiology combines anatomy, biomechanics, and physiology for understanding human movement. In other words, if we were to break those words apart, of course, anatomy is the structure of living things. You've got the biomechanics, which is the study of the structure and function of the biological system. And then physiology, which is the science of the function of the living systems. So combined, we are truly studying how the human body works and moves from the physical therapy perspective in this class. Physical therapists and physical therapist assistants use kinesiology to determine what muscles need to be strengthened and what muscles are used during activities like walking or standing. So if you were to take a patient, they were in a seated position, they needed to get up and stand and then continue on with walking, we need to be able to help our patients regain that ability to perform those activities, such as, if let's say that you have a patient who struggles with standing because of a stroke. So you know that there are neurological deficits, there's physical weakness, so on and so forth. This patient, in order for them to regain function, we as therapists have to know what muscles are being used during the activities and how are we going to strengthen them and what are we going to do to prompt rehabilitation in that patient. So first we have to begin to utilize the same terminology to describe things. We basically have to speak the same language. In other words, you're going to need to know movements of the body. We know them in layman terms as, let's say, just raising your arm. Well, in the medical field, we will go into further detail by saying, medially rotate the shoulder, or let's flex the shoulder, let's extend the shoulder, and so on and so forth. Second, we must know what movement or motions are available at each joint in the body. For example, the elbow and knee can only flex or bend or extend, straighten. But if you take the hip and the shoulder, they are more mobile, so they can flex, they can extend, they can abduct, adduct, and rotate both internally and externally. And if those words sound a little off to you, it's because that is medical terminology. And so we will, again, elaborate on that in this course. So here I have a list of your descriptive terminology that you need to make sure that you know, because here on out in the classroom and in online setting, you will be addressing body movements with these terms. So here's a continued terminology for you. All right, so what I've done is posted a few diagrams for you. You can also locate some of these in your book. Of course, to the left, the picture anterior, which is the front of the body, posterior, which is the back side of the body, and then of course superior and inferior, above or below, medial and lateral, which is inside and outside, and then proximal and distal, far and away, or away and far actually. Okay, so what I have done also is taken a few videos off of YouTube, and I've posted them on here for you. I'll click on this real fast and just show you guys what I'm talking about. There are some great resources online. If there's something you
There's
don't
no such thing as a
understand,
perfect writer. This is why
we're going to skip this ad.
There's no such thing as a perfect writer. This is why I use Grammarly to check my work.
If I'm
So
putting commas in the
what I want to show you here is basically if you need more visual aids, these are great resources for you.
In this video, we'll be discussing
vertically closer to the top of the head in the anatomical position.
All right, I'm going to turn
On the
that
other
part
hand,
off.
a body...
All right, for naming movements at joints and the location of structures, we must have a basic starting position. Typically, the starting position is the anatomical position. So when we discuss anatomical position, it's actually standing with your eyes forward, feet even, and arms at the side of the body with palms facing forward. Fundamental position is a little bit different. It's the same as the anatomical, except the palms are facing the body. So here's your anatomical position right here. And of course, if you turn that into a fundamental position, all you're going to do is turn your palms in towards the body. When describing movement, we should include the following: side of the body, is it right or left? What joint is moving? Shoulder, elbow, wrist, hip, knee, ankle. And then, of course, what motion is occurring? Is it flexion? Is it extension, abduction, and so on? Why is this important? If you are asking yourself that, that's a great question. When we document or perform a treatment, I should say, first, and then we document, we need to be able to document each of these things so that in the case of another therapist coming along behind us and treating the same patient, or we haven't seen that patient for a week, or whatever the case may be, we need to be able to reference back the exact treatment. This is also great for you all as far as covering yourselves when there's any insurance information that needs to be submitted or documentation for the physician, etc. All movements do not occur at all joints. For example, abduction and adduction will not occur at the elbow or the knee, but they will occur at the shoulder and hip joint. So as we study the joints in this course, you'll need to know what movements occur in each joint. In the next few slides, we're going to have you use your body and perform the motion yourself from the anatomical position as you say out loud the joint moving and the motion. So we need to make sure to practice. Starting with the lower extremity, hip, knee, and ankle. In the 6th edition of the book, it's on page 298, and it's figure 18.2. And I didn't actually post that on this particular slide, but you can find it in your book. These are a continued of upper extremity, one lower, shoulder, neck, and feel free to pause at any time and go through and practice these motions. And again, I have attached another link to a YouTube video that gives demonstrations of each of these motions. So make sure you review those motions and make sure you know and understand that they will be on quizzes from here on out. They'll be on assignments in the book, and they'll also be on Unit 1 exam for sure, and then of course you'll have to reference it back when we get to the final. But they're always important to know because as you go on and continue in the next few units, we may reference, medial rotation, and you of course have to know what medial rotation is. Okay, so a couple examples here as far as hip movements go, describing and using the definitions of flexion, extension, etc. Again, go to page 298 for that. Right hip flexion, this occurs by lifting the leg forward. So the anterior surface of the thigh, or the front of the thigh, and the front surface of the trunk come closer together. So if you were to lift your leg forward, you're going to actually flex that hip. If you were in the flexed position and you brought your leg back down to the floor into neutral position or straightened that hip joint, that's considered right hip extension. And then of course from anatomical position in that standing, and you move your leg backward, which is a kickback, then you're performing right hip hyperextension. You'll find that throughout this course we may or may not use extension and hyperextension interchangeably. We do this, each therapist learns the same terminology, but they may interpret some of these motions a little bit differently just make sure that you follow along with your instructor and the pace that they want to go as far as the description of extension and hyperextension. Right hip abduction, that's if you're standing in anatomical position and you lift your leg out to the side. It's away from the midline of the body. Right hip adduction is when you bring your leg back toward the midline of the body or toward a body part. Right hip lateral rotation, this is also called external rotation. You turn or rotate your leg away from the midline. So you do this if you're in the anatomical position. If you move your foot from pointing forward to pointing out to the side, you're actually rotating your hip joint is what you're doing. Even though your foot is rotating, it's happening at the hip. The anterior surface of the thigh moves away from the midline. Again, that's the description. So if we were to do the opposite of that, right hip internal rotation or medial rotation, you're actually rotating your leg towards your midline. So you would have that foot pointing forward and all of a sudden you're going to point it inward. The rotation is actually occurring at the hip. Here's the picture of the hip motions from page 298. So this is a great picture, a little blurry, but very informative when it comes to hip motions. Take a few minutes here to pause the recording, and I want you to list the motions that are occurring at the right hip, right knee, left hip, and left knee. Make sure when you list this on a piece of paper, put the side of the body first, then you name the joint, and then you name the motion. So one thing to keep in mind here, even though this is a still frame, name it by what motion has occurred from the anatomical position. So if you pictured this girl, this gymnast, standing in the anatomical position and then she moved into this position with her lower extremities, what do you suppose has happened? Or what can you picture as far as the motions go? Okay, so how many did you get? This is the starting point for kinesiology. We have to be able to see what motion is occurring at a joint and use the correct terminology. So right hip hyperextension, right knee flexion, as you can tell right here. This is her right side of her body. So she's hyperextending the hip here, and then she's flexing the knee. And then, of course, on the other side, she is also hyperextending the hip. However, this time, what is she doing at the knee? It's straight. So she's in knee extension. Naming joint motions is the starting point, again, for kinesiology. We have to be able to see what motion is occurring at a joint and use the correct terminology. Then we can determine what muscles are working and how they are working. And that comes later on in the following units as far as what muscles do what action. Okay, so here's a still frame again. Sorry, the picture is so small. Another gymnast on the balance beam. What's happening at the left hip, knee, and ankle, and what's happening at the right hip and knee and ankle? So take some time to pause, and then we can move on. So remember, even though this is a still frame, name it by what motion occurred from the anatomical position. So if this gymnast were in the anatomical position, left hip, this side right here, she is flexing the left hip, because remember that anterior thigh is moving towards the anterior part of the trunk. Left knee extension, and then left ankle plantar flexion. She's pointing her toe down. The right hip on the other side is also flexed. The right knee is flexed. And then this is a tricky one for some. What's happening at the ankle here? Well, she didn't actively do anything other than she lowered her body. But once she lowered her body, she put her ankle into dorsiflexion, or the anterior part of her foot was moving towards the anterior portion of her lower leg. Okay, review and activities. take time again to look over your lecture book and even your lab book activities. And this is actually for the on-site class, but feel free as an online student to go through